Hello, my name is Avrie Celestine. Today, I will be doing a presentation on interprofessional education and practice as it pertains to speech language pathology and occupational therapy. How does IPE and IPP relate to SLP and OT practice? Interprofessional education and interprofessional practice directly apply to the scope of practice within the speech pathology and occupational therapy professions. Many times you will have speech language pathologists and OTs working together, not just in parallel in multidisciplinary work, but actually having to consult each other about patients and how to provide the best client care possible. Um, it's not atypical to see this in a school setting or in a medical setting. So it's very important to understand why IPE and IPP is so crucial to both of these professions doing the best that they can in terms of providing great care across the lifespan. This has been determined by the profession's governing bodies. Speech language pathology is governed by the American Speech Language Hearing Association, also known as ASHA, and occupational therapy is governed by the American Occupational Therapy Association. IPE and IPP integration is fairly new for both professions, and this is because of the need to increase the overall positive experience of healthcare and to reduce errors in healthcare when it comes to working with patients. So, because of this, speech language pathology and occupational therapy are going through an evolution currently in the structure and the way that they are conducting practice. So, in my paper, I had 5 articles. Um, my first article was called Working with Children with Autism, an interprofessional simulation based tutorial for speech pathology and occupational therapy students. The second article was Speech Language Pathology, Occupational Therapy, and Physical Therapy Student Perspectives of an Interprofessional Education Simulation. The third article was Interprofessional Education in the Context of Feeding and Swallowing. The fourth article was Speech Language Pathologist Reports of Interprofessional Collaboration and Exposure During Graduate School. And my final article is entitled Short Duration Clinically Based Interprofessional Shadowing and Patient Review Activities may have a role in preparing health professional students to practice collaboratively, a systematic literature review. So, across the 5 studies, the study demographic primarily focuses on university students. The population of students would be second year grad students for the most part, but you can also say graduate students in general. And in terms of the professions, we are focusing on speech pathology and occupational therapy, but the studies do also mention dietetic students and physical therapy students. Mode of delivery and client profiles. So, as I just stated, some of the studies were simulation-based learning studies, meaning that students were using a simulation to do their clinical practice and get experience. But we also did have face-to-face lectures in labs in another study. And in terms of clinical context, um, some of the studies dealt with autism spectrum disorder, so clients that have been diagnosed with ASD, and also feeding and swallowing. What does the literature say? So, according to the literature, interprofessional education and practice is tangible. This means that positive effects can occur and positive change does happen when IPE and IPP is implemented in the appropriate ways. Um, the students are able to reap the benefits of IPE through formal IPE events that positively affect student learning outcomes. And these outcomes are able to be measured, which I will get to in a few minutes. One of the great things that the studies indicated were there was a significant increase in the perception of SLP, OT, and dietetic students in regards to the importance of IPE after they actually had the opportunity to be in a setting where they were able to apply those efforts. So they got to be interactive and they collaborated with each other. So that brings us back to the about, from, and with aspect of the World Health Organization's definition of interprofessional education and practice. The literature also says that IPE should be structured into the graduate school curriculum because when it's structured into the curriculum, it's giving students a chance to practice all the way from learning in an academic setting so that when they get into the professional setting, they already have a solid foundation. And it's important to note that this should be integrated into the school curriculum per the standards implemented by the governing bodies of ASHA, the American Occupational Therapy Association, the Council on Academic Accreditation, and the Academy of Nutrition and Dietetics. Students also learn the importance of advocating for themselves in their profession, and this directly ties into the interprofessional education competency of roles and responsibilities. It's very important for speech language pathology students and occupational therapy students to know the role that they play and to be able to apply that into their practice. So across the 5 EBP articles, it is noted that students finished the study with more knowledge of what they did not know and how the areas requiring more knowledge and practice for them are. Students completed this study with a concrete understanding of comorbidities and how complex they can be. And this means that the students are able to see that a lot of times with clients, they're not dealing with just one thing. Sometimes you may have a client who has a feeding and swallowing issue, but also may have a severe speech and language issue. And you have to be able to balance both of those out in terms of the care that you provide. Literature was limited regarding SLP, OT, and PT interprofessional education, but it was noted that it is beneficial to choose these 3 professions when you're talking about IPE and IPP in an acute care setting. And this is because it provides valuable info about the scope of knowledge of what it is like for SLPs, OTs, and PT students to collaborate in settings that have high stress. Findings. One of the most important findings of the studies are the fact that data measurement tools are used to measure the validity of IPE outcomes. So an example of this would be the SPICE tool. So the SPICE tool stands for Student Perceptions of Interprofessional Clinical Education, and then also the IPEC set, and that is the Interprofessional Education Collaborative Competency Self-Efficacy tool. So these tools are used to measure how valid the IPE outcomes are, but also if they are reliable. So the SPICE-R measuring tool was deemed as highly reliable, according to the literature, and its design was also user-friendly. It involved 10 questions regarding teamwork. 6 of the questions pertain to teamwork, then 2 questions for roles and responsibilities, and then 2 questions for collaborative practices effects on patient outcomes. So these questions were placed on a Likert scale with examples of statements being working with students from another profession enhances my education, and the participants were able to say if they strongly agreed with this or strongly disagreed, etc. The IPEC set was also seen as a valuable measuring tool for qualitative data related to IPE and IPP. So this means that the quality of the experience was able to really be captured. Another set of findings our feedback is valuable in determining how to better improve IPE and IPP for graduate students. This simply means that students really enjoy getting to know what they were doing correctly and what they could do better, because that's how they grow and that's how they will know how to truly collaborate and work with each other as a team. Healthcare students do hold their own individual perceptions regarding their role in interprofessional patient care. So before even having a chance to interact with each other, students have a perception of what their role should be in terms of working on an interdisciplinary team. And sometimes those perceptions match up with what actually is required of them within their scope of practice, and sometimes they don't. Collecting data should occur via a reliable and valid measurement tool, and it should be tested by multiple groups. It's not just enough to know that your tool, like the SPICE tool or the IPEC set tool, works. You have to be able to know that it works multiple times and with multiple different groups of people. Also, it's important to know that IPE and IPP is being implemented at higher rates because we are currently in a patient care epidemic. And this consists of the occurrence of chronic diseases in a complex healthcare system that is also being driven by technology. IPE needs to occur across all healthcare professions to have major lasting positive effects on patient care. It's not just enough to have this going on between doctors, nurses, and pharmaceutical um, employees. It's important to have this go on with speech language pathologists, physical therapists, and occupational therapists as well, because typically you're going to have these people on your team in these settings as well. It's also important to know that the scopes of practice for SLPs, OTs, and dietitians complement each other and operate of each other's strengths. And then finally, feeding and swallowing is a great area to practice IPE because it is complex and it affects patients across the lifespan. Think about it. It's something that you will do for the rest of your life. You will have to eat to get nutrition and to survive. So it's the perfect way for IPE and IPP to be practiced because it's something that you can't escape and that multiple professions have to take account of in terms of a patient's overall health. Finally, the literature brought me to the conclusion that without interprofessional education and practice, many students would lack the confidence needed to begin effective professional practice and would lack clear understanding of the significant role they play in patient care across the lifespan. And then finally, I do have my references from my articles just so I can show where the information is being referenced from. Thank you.